my name is Jenilyn Rubel. I'm going to demonstrate insertion and discontinuation of peripheral IV. Before I begin, I will check my orders. That I have my orders. I have the right patient as well as I have the right procedure. I gathered my supply. I have my hand sanitizer, my gloves, IV start kits, my saline flush, my sharp container, my tape, pre-cut tape, as well as my needle. For this procedure, we are doing blood transfusion, so we need 18 gauge. I only have one 18 gauge in my supply, so I'm simulating using a 22 gauge, but this is simulated in 18 gauge. We are ready. We are going to, before we enter the patient room, we are verifying that we have the right order as well as we have the right patient, and we gather all of our supplies. I will go knock. I'll close the door behind me for privacy, and then I'll introduce myself. Hello, ma'am. My name is Jenilyn Rubel. I'm your nurse for today. How are you doing today? I'm doing good. I will, before we begin, I will verify your full name and your birthday. So Mary Thompson, and May 5, 1985. All right, thank you. And then I'll verify that to my patient's wristband, making sure that it is a match. All right, ma'am, today I'm going to do an IV insertion so we can administer your blood transfusion. Is that okay? At any point that you have any question, you just let me know, okay? This procedure will take about 10 minutes. Patient agree, we are good to go. So I'm gonna perform hand hygiene and then put my gloves on. This procedure is an aseptic technique, so normally all of my packaging is sealed, and then you prepare next in the bedside next to the patient or in the chair. So I will get all my supply here. I will prepare my tubing, make sure that there's no air on the line, and push a little bit of saline. All right, ma'am, before we begin, do you have any allergies? No allergies. All right, we are ready to begin. Tourniquet need to be placed 4 to 6 inches above our insertion site. Tourniquet need to be on a quick release placement, just so we can find a vein and we can't leave this too long to our patients, so it's easy release. Need to be placed 4 to 6 inches above the insertion area. We check the pulse below the insertion area, distal to the tourniquet. We have a pulse, so we are good to go. We clean the site. Chlorhexidine, up and down motion, but we're using alcohol, so we can do circular motion. Leave it for about 30 seconds and let it dry. For our needle, it needs to be bevel up. Bevel up. I always look at this hub in here. Sometimes when it's open, it is in the same direction as the bevel. All right, area is dry. We are anchoring. We anchor about 2 inches to our insertion size. Insertion site. Bevel up about 30 to 45 degree angle. We insert. We see a flush. We flatten a little bit and insert just a tad bit. and then push in our catheter. Have a positive control of our catheter as we remove our needle sharps. We have our IV line. Then we are going to secure our lower lock. Attach our lower lock. There you go. Positive control. Remove our tourniquet. We draw back. We have a flush, and we can do a saline flush. We are good. Normally before I will go remove this, I will secure using my Tegaderm. Just like so. And then you can remove this paper right here. Make sure that the area where you inserted, you can easily see it, so you can always inspect if something is wrong with your line. All right, we are good. I can remove this. That's after we already flush it. And then assess our patient. Make sure that there's no infiltration, there's no issue on the line, and that there's no swelling and redness, and that our patient is comfortable. And then we get one of our tape and loop it up like just so. And then I think I'll put it back. We initial this with our name, the time, and the size of our catheter. (18 gauge, my initial, as well as the time. Then we place it right above our Tegaderm. All right, I am going to clamp my tubing, and then I will make sure that my patient has a cold light, and that my patient has cold light. I will lower the bed. Ma'am, do you have any questions? And no questions, so we are good. I'm going to clean my area, making sure I throw everything away, remove my gloves, and then I will going to document this, the gauge, the time, and which area or where did I place my IV. I will wash my hands, perform hand hygiene, and then, ma'am, do you have any question? We are good. All right. Oh, I will just get all this inside here. Then I will continue on to my discontinuation video. Get this out, put that away. For the IV discontinuation, I will need a tape and then my gauze. The same thing, I'll make sure that I have the order to remove my IV line. I have the right patient as well as my orders. So I'm going to knock, introduce myself. Hello, ma'am, how are you doing? I'm Jelalyn, I'm your nurse for today. I am going to remove your IV line, okay? If you could verify your full name and birthday for me. Mary Thompson, May 5, 1985. I'm going to remove your IV line, and do you have any question? Right, the procedure is about 5 minutes. I forgot the gloves. I have my gloves, perform hand hygiene, and then put my gloves on. I will prep my tape, and then I will inspect that my tubing is secure, it is clamped, so, and then I'm going to remove it using gauze and my tape. So first thing you do is remove the tape and then the tegaderm. I normally wait until I'm a little closer before getting my gauze. Place it in there, advance a little more, and then I have my gauze. I tape it right in my gloves, and then put pressure and pull, and then hold pressure, and then about 30 seconds, and then secure it with tape. Okay, that much. All right, that's good. I'm gonna lower my patient bed. Ask question, ma'am. Do you have any questions? I have the call light. Let me know if you need anything, okay? I will remove my gloves, clean everything, put everything away, lower my patient bed, wash my hands, and then I will thank my patient.